Hi, everyone. It's Dr. Paul from East Ontario Health Unit, giving you a weekly COVID update on today, May 25th, 2022. And as usual, I'm going to start with sharing my screen to give you the latest statistics. So let's begin again, as usual, with our local health unit statistics. And you can see here, we still have people hospitalized, none in the ICU. However, the trends are going downwards. Our positivity is lower. If we look at our hospitalizations, again, overall, we are decreasing. And again, we are getting decreased cases on a day-to-day basis and a weekly basis, and it takes a week or two until the hospitalizations start following suit. It's always a bit of a lag, but we are seeing it in the right direction. If we're looking at our hospitals, our 4 hospitals with admissions for COVID, you can see again slight downward trend. Over the weekend, I want to note that it's not that there were no admissions, it's we did not have any information from the hospitals because of the holiday. That's why it went down. So it was steady over the weekend, but again, we didn't have the data to put into our graph. So it wasn't that there were no admissions. I just want to clarify that. It's just that we didn't have the data on the week because of the long weekend. And obviously, communications were also made difficult by the storm that happened this past weekend as well. In terms of our positivity, again, we are going in the right direction. Now we're at 7.8%, which is very good for our area, considering we were in the high 20s and 30s in certain areas, about a month or two ago. And so we are seeing a downward trend. I'd really like it to go downwards. I'd be happy if it's below 4%. And I think we are getting there. But for now, we're seeing a nice trend. Outbreaks, again, kind of stable overall, hovering between 8 and 10 and 11. And again, I do anticipate those to go down with time because they take longer to resolve. In terms of our wastewater, we can see that in all 3, Hawkesbury, Cornwall, and Castleman, we can see that the trends are going downwards or flattening. And if we look at the provincial data, be it new cases, be it deaths, be it positivity, outbreaks, hospitalizations, or ICU, we see a decrease, a 43% decrease all along. You can see 43% decrease in cases, 31% decreases in deaths, 23% decrease in positivity, 57% decrease in outbreaks, 28% decrease in hospitalizations, and an 11% decrease in ICU. So again, all trending in the right direction, including the wastewater signal that we're seeing here across the province. So Ontario, you can see clearly that we peaked around April, and we're going downwards now. So the downward trend, same in Eastern in our area, and you can see across the board where we see a downward trend or a leveling off, but nothing increasing. So again, all signs in the right direction. And if we look at comparing the province in terms of positivity, again, we're looking at the positivity going down as well provincially. We can see the number of cases now. We're at 46 average cases per 100,000 per week here. Just to note that last week we were at 56, so we're down week by week, and this is happening across the board. We can actually, there's another graph which I thought I had here, which I didn't put in, but we can see, again, all 34 health units have had no increase. They're all on the way down. You can also see as well the trends. So the blue is the cases, and you can see the cases are going downwards. And like I said, there's a bit of a lag in terms of a week or two lag between hospitalizations and cases. And you can see our ICUs are steadily going down. But again, nothing as high as the previous wave that we had in January, February. So again, good news all along. In terms of vaccinations, we're kind of steady, not much of an increase there. We're still at 57% of our population having received the 3rd dose. We need to go higher than that. We're 28% of our population with a 4th dose. And if we look at the demographics, you could see that more than half now of our 80-year-olds have had their 4th dose, and about a third of our 70 to 79, and less than 20% of our 60 to 69. So we've got a way to go here for 4th dose and 3rd dose as well. You can see the green. We needed to be up high here, so we need to get that green, that that number up as much as we can. Again, I've explained why in several times in the past. It's because you get longer protection and you get protection against spreading it if you get a breakthrough infection with a third dose, much higher as compared to a two-dose. And obviously, again, just looking at the cases in the red here are not vaccinated, and you can see that certainly, cases, hospitalizations, and ICU admissions and even deaths predominantly occur in the individuals who are not vaccinated or partially vaccinated. And you could see predominantly the severe disease occurs mostly in people 60s, 70s, and 80s. That's why I'd like very much to protect this age group, at least for now, that with a fourth dose. And we've got a ways to go here for 60 to 69s. We have had severe disease in that age group, particularly with underlying medical conditions. We've had 2 more deaths added to our health unit numbers over the last week, both of which were partially vaccinated, not fully vaccinated, and both had underlying medical conditions as well. So it just raises the importance of getting that optimal protection against the disease, particularly if you're in a vulnerable situation. So that's to me, it's again, the call to action is really getting your third dose, getting your fourth dose, because this is the way we'll be able to keep the numbers flat as possible over the summer going to the fall months. Now, I just want to, I usually talk about COVID only, but I wanted to give you a bit of an update of what's going on. As you know, we've had a major rainstorm, derecho was called. I'm not sure if tornadoes hit down, but we've had huge devastation across Ontario, particularly across Eastern Ontario. I know that we've had a state of emergency declared in Clarence Rockland. Hammond, tremendous amount of injury, damage has been done. And that's why they declared the emergency in Hammond and in the Clarence Rockland area. They're starting to get power back. However, there's still large areas in Hammond area that have no power. The city of Clarence Rockland has, because of the declared emergency, have also opened up a shelter at the Clarence Creek Arena for people to go in and take a shower, get water, get bottled water, and charge their devices. So that's opened. So keep that in mind. Some reminders as well. I know that if you have power outages, please do not use candles at home. As much as possible, use flashlights or those fake candles with light bulbs in them. Careful about generators. Please be careful about gas use and so on. Do not have them inside. Have them outside where it's very well ventilated. The other thing too as well is please do not barbecue indoors. I know that people may want to barbecue indoors, but a lot of that's a fire and fume damage, fume threat. And again, a reminder, at this point, it's been a couple of days now, obviously, that unfortunately things in the fridge need to be thrown out, particularly all the perishables, and freezers can only last 24 hours if they're half full, and about 48 hours if they're full. So again, unfortunately, that's going to have to be a lot of that food has to be discarded because again, it'll spoil. That's a bad thing. But please be careful about that. And our hearts go out to the 10 individuals that lost their lives, including one individual, a resident of Cornwall, that lost her life in Peterborough this past weekend, who succumbed to a falling tree. Very tragic. Hearts go out to the family with our condolences. The influenza, I put this up here again because we are still getting cases of influenza, and so it's just to keep people aware that that's still out there. So so if you have symptoms, may not necessarily be COVID; it could be influenza. We've had some outbreaks, some cases, and so just to keep in mind and. Keep in mind that for coming into the fall, we will have influenza coming back. So that'll be something that we need to vaccinate against at that time. And then finally, I just want to finish with monkeypox. I know you've heard about it in the news and the media. Monkeypox is a virus that is related to smallpox. It's not smallpox. It's not as dangerous as smallpox. It was first discovered in 1958 in Africa. Actually, it was lab monkeys at that time. It's not, but it can infect other animals. It's not necessarily monkeys, but it's just they call it that. They've had human cases on and off in Africa for years. There was an outbreak in 2003 in the United States that was traced to prairie dogs that were in contact with some animals from Ghana, I think it was. In any case, that's happened there. And now what we're seeing is cases, about 17 or 18 cases in Montreal. There was one case in Toronto that was linked to the Montreal cases as well. We're seeing about 250 cases worldwide outside of Africa. And this is what's puzzling us, because usually you see it in Africa. This is an infection that is spread by respiratory droplets, so close face-to-face contact, prolonged contact, skin-to-skin contact, as well as contact with contaminated linen, bed sheets, and those type of things. So it's at this point, it is not a public health risk. It's something of public health interest. We are working to ensure that physicians know how to diagnose it and let us know. As part of our surveillance in Ontario, there's been only one case in Toronto, and that's been linked to the Montreal cases. At this point, there is no, I'm not panicking. We're just looking, increasing our vigilance to ensure that we're following up on cases and diagnosing them. There's no treatment in most cases. The incubation period is about 7 to 14 days. Starts with a bit of a prodrome, in other words, mild, non-specific symptoms like runny nose, cough, a bit of fever, a bit malaise. Then the rash starts, and the rash lasts for about 2 to 3 weeks, and people are infectious until the rash dries out. It's a bit of a pox rash, a large pimple type of thing. And so there's no treatment. However, most people recover spontaneously without treatment, and all they need is to be isolated. There are vaccines available. The smallpox vaccine works for this. It will be offered to individuals who are in contact with a case, but there's no need for widespread vaccination, and we are not worried about widespread infection at this point. It's just a matter of trying to contain it and better understand it, because it really has not happened before. So I just want people to understand that there's no issue here. But if you do have symptoms or suspect, if you're in contact with somebody, please go to your healthcare professional for diagnosis and perhaps some contact tracing. But again, this is not a public health emergency. It's something of public health interest and little risk to the general population. So thank you, and I'll talk to you next week.